everyone, so let's move towards our today's topic, which is what is ischemia heart disease. Ischemia, as you know, what is ischemia? Ischemia is the low blood supply, or when there is no blood supply or there will be a low blood supply, you can say that there will be ischemia. And there should be a blood supply to every organ, and obviously, as you know, every organ requires oxygen, and oxygen will be taken in that organ by blood, and through blood the oxygen will supply to that organ. If the blood is not supplying, that means that organ has low blood supply. So how this happens? First of all, ischemia heart disease is also known as coronary heart disease. If the blood supply to the heart, not if the blood supply of the heart, if the blood supply to the heart, that is the heart is supplying through the heart is supplied by coronary artery. So if that coronary artery will be affected or involved in the atherosclerosis process, if atherosclerosis occurs in the coronary artery, that will lead to coronary heart disease or ischemia heart disease, also known as IHD. Now, obviously, like I said, every muscle, every cell in the body requires blood, requires oxygen, and that oxygen will be taken in that organ by or through blood. But if the blood is not supplying properly, or if there is no blood flow, that cell might be die. And if the heart cell will be die, there will be no contraction and relaxation of that heart, and that will lead to heart attack also. And heart attack, if there will be a long duration of their no blood supply, there is a chance of death also. So this is a very dangerous disease for patient as well. But before doing this topic, you have to remember, you have to understand the topic of atherosclerosis, which I have already recorded. Now, ischemia heart disease. Ischemia heart disease, it occurs in three stages. It can be occur in three stages, that is angina pectoris, myocardial infarction, and sudden heart death. Sudden heart death is due to the blockage of the coronary artery, and if there is complete blockage of the coronary artery, the blood will not supply to the heart. Due to that, the heart will be dead, and that obviously it lead to death of a person also. Now, usually atherosclerosis, not usually, but atherosclerosis, if atherosclerosis is in the coronary artery, that is known as ischemia heart disease. Now, first we talk about angina pectoris. What is angina pectoris? Angina pectoris means chest pain, and the chest pain due to temporary blood supply to the heart, temporary loss of blood supply to the heart, that is called angina pectoris, that is chest pain. There are three types of angina pectoris: typical or stable angina pectoris, Prinzmetal or variant angina pectoris, unstable or crescendo angina pectoris. First, we talk about stable angina pectoris, which is also known as typical angina pectoris. If the plaque is completely blocked, if the plaque which is occurred due to atherosclerosis, that is atherosclerosis, in atherosclerosis, as you know, plaque is formed. So if the plaque is formed in the whole lumen, that will block that vessel, due to which there will be pain in that chest. Obviously, in chest there will be a pain if there is a stable angina. But stable angina occurs when you move or when you do exercise. There will be chest pain, and that is a sign, that is a symptom that you can identify that there will be a atherosclerosis in the coronary artery. Now, the second type is Prinzmetal or variant angina or intermediate angina. It is caused by contraction of the coronary artery near or on the site of atherosclerosis, where the atherosclerosis, the site of the coronary artery where the atherosclerosis occur, if on that side or nearby that side the contraction of the coronary artery occur because, as you know, that atherosclerosis causes the smooth muscle migration. So if there is a contraction and the coronary artery will contract, there will be blockage, or there will be temporary loss of the blood supply to the heart. Okay, now the third type is unstable or crescendo angina. It occurs at rest and plaque is not fixed. Okay, in stable angina, plaque is fixed and it blocks the whole coronary artery. But in unstable or crescendo angina, it occurs at rest and the plaque is not fixed. Now, another thing, myocardial infarction. A myocardial infarction is also known as heart attack, and male are usually affected. And the symptoms of the myocardial infarction are sweating, fatigue, and the treatment is angiography and fibrinolytic therapy वगैरह आप करवा सकते हैं in myocardial infarction. What is myocardial infarction? Like I said, it is heart attack. Now, angina pectoris में हम lumen की बात कर रहे थे, but in myocardial infarction we will talk about myocardium, that is muscles of the heart. So if the as you know that there is a thickness in the ventricle, so if the whole thickness of the ventricle, whole wall of the heart is involved or is affected due to ischemia, that is called as transmural infection, and this will lead to elevation in ST segment. Remember this point. What is ST segment? We have already studied in the ECG electrocardiogram that ST segment is formed when after the ST segment is formed after QRS complex, and between QRS complex and T wave there is a segment there is a isometric line, straight line, that is ST segment. If we see the ECG and there is an elevation in the ST segment, we can say that there is a myocardial infection and there is a transmural infection, that the whole ventricle is involved. Number 2, subendothelial infection. If 1/3 thickness of the ventricle is involved, this is known as subendothelial infection, and there will be no elevation in the ST segment. Okay. Number 3 is microscopic infection. If the small part of the myocardium is affected, and obviously if a small part is affected, there will be heart attack, but there are some types, or there are some obviously there are some classification, but that if the whole ventricle is involved, that is transmural. If the 1/3 part is involved, subendothelial. If small part is involved, that is called as microscopic infection, and there will be no change in ECG. One more thing, that usually in myocardial infection left ventricle is involved. Okay, why? Because if the right ventricle is not in 1% cases of the myocardial infarction, right ventricle is involved, usually there will be affected, or the left ventricle will be affected due to myocardial infection. So this is the whole topic. So guys, take care of yourself and study hard, work hard, and good luck. Bye.